The time is 12 noon, and I call this meeting to order. We'll stand for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We remain standing for a moment of silence. Thank you. Next, we have open forum.
Good afternoon, Mr. Ross. Good afternoon, board members. We do have one staff member open forum, and that would be Ms. Gonzalez. So, Ms. Gonzalez, if you allow me, just read the statement that we read every time, open forum, and then we'll allow you 3 minutes to talk.
Thank you.
So the next item is public comment. The public comment portion of our meeting, members of the public who wish to address the item to be considered by the board on today's agenda. Anyone who wants to speak during the meeting must sign in prior to the start of the meeting and list the agenda item to discuss. Each public comments will be allowed a maximum of 3 minutes to address the board. Any testimony speakers requires up to 2 times allowed as much time as the speaker. The public comment portion of the meeting will allow all speakers to have time before the start of the meeting to address the board at this time regarding on tonight's agenda. I ask that you do not discuss items who are not on your own time. Policy, DGBA, the FNP, and GF are available for specific complaints regarding parent and community member complaints respectively. Thank you. Our first speaker, our only speaker is Ms. Gonzalez, Yolanda Gonzalez.
Thank you. It's really bad echo. I don't know if you're catching that. But I see that you have on your agenda the human resources, the request to approve to ratify premium pay, start date payments, and adopt resolution regarding said payments. So I felt it appropriate to speak a little bit on some of the concerns that have been addressed to the organization regarding this. Recently here, and also in discussions with Dr. Sorolla, who has been very informative in sharing what's going on and some recent decisions and so forth. But also in some of those decisions, some concerns have been raised to the organization regarding the premium pay. It's our understanding that premium pay is only allowed now for employees who actually have actual interaction with the public, which I believe there are some of the curbside servers and some of the drivers perhaps who are delivering some of the food. And then possibly some of the police department. And our concern is just regarding that whole scenario is that, for example, in food service, any curbside employee is equally, has as much contact with the public as they will with the employees inside, because they're all working together. And so that exposes everybody. So, and at any given time, any employee can be pulled off to go help the curbside as well. So it's not that simple to just say only the servers on the curbside are eligible for premium pay, especially now that summer pay is kicking in. It's a $10 an hour flat rate. You know, that means that the employee, if the premium pay is to stay the same, the curbside servers would only be the ones to earn the $10 additional. Everybody else that's working on the front lines, because that's what it is, are still exposed, and they're still there, and they're still doing a job for the district. So putting all those employees together puts them at equal risk, regardless if some of them are outside or some of them are inside during the workday. When it comes to actual the police force, our concern is that at any given time, any police officer can engage with any public member. May not be But there have been time to time where things have come up. They have to visit with even a state trooper employee who's obviously a member of the public, and who, or any community member, or any situation. So in that case, I think that the police force should continue on premium pay for that rationale that they're constantly exposed, just like child nutrition and the drivers who are delivering food. And we wanted to ask that the board think about that, that if we're gonna, if the district is deeming that it's just appropriate to provide the premium pay to the people that they consider the frontliners, all these people are frontliners because they are there every day. They are there coming to work every day, and they are working with the public to some degree. And so we are asking that that please be the consideration of the board today regarding that item on under
you, Ms.
human resources.
Thank you, Ms. Gonzalez.
Thank you.
Thank you again, Ms. Watts and board members. We have Ms. Cancino. She's here to provide us with some updates on our budget for the current fiscal year, but also as we start planning for next school year. Ms. Cancino?
Trying to switch over to.
We can hear you, so.
You can hear me?
Yes.
I'm trying to share my screen, sir.
Okay.
But I'm using two, so I don't know if that's a problem.
Okay.
It says you disabled my screen sharing.
So we need to make sure we do the multiple sharing. So give us a second, Ms. Cancino. Okay, Ms. Cancino, can you try again?
It doesn't let me, sir.
Yeah, it says the host disabled participant screen sharing, so we have to make sure it's. Ms. Cancino, go ahead and try again, please.
Yes, sir. Can you all see my screen?
Yes, Ms. Cal. What? I don't know, but I need to see my screen because I need to let people into the meeting. Just move mine down here.
Mute his
Who? Governor?
Valentine, yeah.
Mute. She's open.
Okay.
Yours.
Ms. Cancino,
Yes, sir.
we're ready.
Okay.
See you.
Well, good afternoon. Good afternoon, board members, ladies and gentlemen. We're here to present an update on the current budget, the status of the current budget, and the 2020-21 budget outlook. Please. So we will be doing an update on the 2019-20 budget. I will be going over the current tax collections summary report, student enrollment in ADA, the 2021 budget outlook, and then I will be answering any questions you may have. Just a quick review of what our current budget looks like. We have budgeted a total 155,207,080 of total revenues, with total expenditures of 156,493,707 for a budgeted deficit of 1,286,627. The deficit came into place in a budget amendment that we did in December for the purchase of the laptops and Chromebooks for students and teachers. Just again, a quick recap on where we get our revenues. The three major sources are our local revenues, which are primarily our property tax collections, our state revenue, which we receive from the state of Texas, and our federal revenues, and the big chunk of it is from our CHARGE program, also E-rate, when we do have projects that we get reimbursed on. So just to recap a little bit on our current tax collections, monthly we submit a report for the board to review. So basically right here what we have is a comparison of last year's tax collections to current year tax collections. So in 18-19, at this point in time for the month of April, we were at 95%. Currently, we are almost at 93%. So we have a decrease of 2.259 in the tax collections. Some of that may be due to the closure of the tax office. Also, people not wanting to be out and about and paying their taxes. So that may be contributing factors for the decrease in our tax collections. So we do anticipate that maybe this year, which if you see in 18-19, at the end of August, we were at 99.86 of budgeted collections. So we were only short 21,000 of what we had planned we were going to collect to actual. So that is very good. The district normally does very well in tax collections. For our state revenues, this is where we get the chunk of our money. So for this year, we budgeted with ADA of 13,143. Currently, as of the 4-6 weeks, we are at 13,124, which is a difference of 19. Our foundation school program is the one that we get the bulk of the money from, and you'll see there on our projected, we are expecting to collect above $445,000 than what we had anticipated. And our available school fund will be about $155,000 above, for a total increase from budget in total state aid of $600,000. So for next year, some of the concerns that we have as we look at the budget planning for the 2021 school year is how this COVID has really affected the employment rate. We have about nation, I believe, about 20% unemployment rate. So we anticipate that having an effect on our tax collections. If our taxpayers are not working, then they may not be able to pay their property taxes. So we anticipate maybe having a decrease in our local taxes. We also have ADA concerns, and as you know, most of our state comes from our ADA. So right now, TA has no guidance for next year as to how we're going to treat the absences. So not knowing how this is going to be handled for next year really puts the district in a bind as far as trying to project how much we're going to get for next year, because we don't know how to treat it. We know that for this year, they've said so far that first through the 4 6 weeks, it will be on actuals, on our actual ADA, and the 5th and the 6th, they will apply a historical rate. We still don't know what historical means to them. Are they going to look at the past 3 years? Are they going to look at the past 5 years? We're still not clear on what the historical rate will be. And also, if we have low attendance rates, then we also anticipate a decrease in our SHARS billing. So we are anticipating having a decrease in revenues in all 3 areas. So for this year, just to give you an example of what a percent reduction in our revenues would look like. For this year, you have there the 1920, the 17.8 million dollars that we budgeted for tax collections, and then you have the different scenarios if we were to have a 5% decrease, 10% decrease, or 15% decrease. And the total decrease in revenues there at the bottom in red, you see the $7.8 million in the 2021 with the 5%, $15.5 million with 10%, and with the 15%, we're looking at a little over $23 million. And our revenues pretty much mirror our expenditures. So you'll see that translate also into our expenditures. Now, to be honest with you, this is a very unrealistic reduction in our budget, because I can't apply a 10% reduction across the board to every single item I budget, because most of it will be payroll cost. So about 80% of the budget that we adopted is made up of payroll costs. So this is just an example of something that I don't think we can do, but this is what it would look like. So this year, the district did very well with our revenues, and I think we were able to budget for a lot of things that we needed. Was it maybe upgrading some of our facilities, the purchase of the technology equipment? We had budgeted for buses that we didn't get to purchase this year. We moved those funds to use for the technology equipment purchases and other needs that we've had. So some of the things that we could cut from this current budget as it stands right now, that I think will not have a major effect on the district, and this is not even considering touching anything on salaries and payroll. So our HVAC projects, we normally budget about $1 million. So maybe next year we only budget half of that. For our technology equipment, the purchase we did this year, it's a one-time purchase. We don't anticipate that doing this purchase again next year. So that will be a savings of $3 from this budget. Buses, we budgeted $500,000 this year, which, we don't have to budget next year. Also proposing a reduction of 15% to campus and department budgets, and this would be out of their supplies and their travel budgets, not touching anything that is a commitment, so no contracted services or licenses. So this would net about $1.5 million savings. For every 5% increase, it'll be about $500,000. We budget about $10 million for supplies and travel. Reduction in overtime and extra duty pay, we could save there $500,000, possibly more. I think that's one of the areas that we could be monitor more closely and net more savings. And just in other areas that we've been able to spend money, was it to maybe repair some of the things that we may not need to do next year. I know we're spending a lot of money on our risers and at the different campuses. So those are one-time expenditures that we may not need to do next year. So that'll be another $1 million. So out of this current budget, we could cut about $7 million and not have a major effect on the district aside from the campus and department budgets. So I think that if we, given if we have anything from guidance from the state and we have that reduction of 5% in our revenues, that's something that the district could cover without having a major effect with these reductions. The other concern that we have for next year is we have the planning amounts for our federal programs, and there I'm putting there the ones from the ESSA application. And then the 1920 school year, this is our current grant awarded amounts. You have our Title I Part A with $11.2 million. For next year, we're anticipating $9.8 million. So that is a decrease of $1.4 million. Our Title I Part C migrant is the one that is being decreased the most. Currently, it's a $2.5 million budget. For next year, it'll be $824,000. That's a decrease of almost $1.8 million. And then you have the rest of them there. I highlighted these in red because these two, actually, we pay salaries out of these two funds. The rest we don't. So we just don't do something. But here we do have personnel in those two. I am not too worried about the Title I Part A as far as salaries is concerned, because right now we've spent out of that budget about $1.5 million for technology equipment. So that's not a cost that we will have next year again. So we're able to reduce automatically about that amount from the budget. And that is it for my presentation. Does anybody have any questions?
Yeah, Ludi.
Yes, sir.
I understand that there was a lot of money that was redirected from every account to help the technology purchases
Yes,
of all those Chromebooks and laptops. Was that shared across the board evenly, or were some departments hit heavier on a percentage basis than others?
We went by student population. So we did count. So if we had, let's say, 800, most of them were hit from the state comp and the Title I. And then the rest were done by population group. So the migrant took care of only the employees that qualified, that are identified for migrant. The special ed only for the students that are identified for special ed. And then basically everybody else fell under the umbrella of the state comp or the Title I.
Okay. So the funds were actually taken out of each account on a even distribution.
Yes, sir. And the directors, I send the breakdown to the directors that manage those funds to get approval before we did the purchase on the accounts of students.
Okay. Now, other question was, I understand that a lot of these departments had supplies and things that were not able to purchase because their funds were frozen. And,
correct.
So what are we going to do next year when some of those funds should have been utilized to cover the gap?
Well, right. The reason why we feel comfortable with maybe freezing some of these accounts are, the major one was we did not have kids in the classroom. So I did not see, and honestly, we did not see as a group a need to order things that were just going to be sitting there when these monies are going to roll over. And when we're talking about federal funds, these monies will roll over to the next year. What we also decided to do, I think, was to do district initiatives, and this is where we pulled all this money to buy all this technology equipment. I mean, you don't just come up with $3 million out of thin air. So we had to go and look at the areas where we had pockets of money sitting. Now, a lot of this was picked up by our federal funds. So I can't recall exactly the number, but we used three federal funds really. We used Title I, we used Migrant for the migrant students, and then there was another one that we used, and I don't recall which one currently. So right now, given that I think we need to save as much as we can from our budget, because we may need those funds next year. Remember, next year.
Was that third account? That third account you took money out of, was that out of the advanced academics?
No, sir. None of it came out of it.
Okay. 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 Thank you.
If I may finish on the conserving the funds from this year. So I really do think we need to save as much as we can from this current year, because whatever, and now I'm talking specifically about the general fund, whatever we're able to save this year rolls into our fund balance so that we have more money to be able to pool if we need more money. If we need money from our fund balance for next year, then we have that money sitting there. So that's why I think that right now, it's only, is it absolutely necessary? Do we need it? Right now, then we do it. But if we don't need it, if it's just to spend because you see the money sitting on your budget, then I really do think the district needs to be monitor that and not spend that money.
Ms. Cancino, I have a question. Can you hear me?
Yes, ma'am.
Yes, I noticed that the migrant funding for next year is drastically reduced. It's gone down a lot. Has the migrant, because
yes, ma'am,
like you presented a plan for 5%, 10%, excellent plan. I love them. Do you know if the migrant director has done such a plan because her expenditures, her funding is going to be dropped significantly. So what are her plans to make that adjustment?
I do not know, ma'am. I have not spoken to the migrant director. What I will tell you is that I had, in the past, I had met with her and I had advised that because a lot of this $2.5 million is actually a carryover from a previous year, which means that you will not get it this year unless you have another carryover. So right. I had advised that we needed to be conservative. We need to spend our money, but we also need to make sure that we have a little bit left over in case we did need it and we had a reduction in our funding, because we have seen our migrant funds fluctuate. Sometimes they decrease and then the next year they increase and then they decrease. But this is half of the planning amount. Last year, the actual award, I believe it's $1.8 million. The rest of it, I think, is carry forward. So you can't count on the carry forward having it next year if you spend it this year. So that's why I advise to be conservative. Now, I don't know how much we're going to have of carry over this year, but that's also one of the reasons when I had a meeting with the migrant program was on that carryover amount, where you don't want to use that for personnel precisely for this reason right here. Because in the next year, you're not sure if you're going to get that money. And then what do you do with the people that were hired? Right.
Correct. Exactly. Yeah, because I think they're looking like at about, more or less based on those numbers, they're looking at about a $600,000 reduction. That's, so I hope she has like a plan on how she's going to make that adjustment. But anyway, I don't have any further questions.
These numbers just came out, so I'm sure she's in the works in looking at what we need to do. But that is less than what we have in salaries alone. A lot less for that program.
We will look into all this stuff, Dr. Valdez. Obviously, we want to be prepared and ready to go, right? And we will have to make the right decisions for our districts, considering the amount of money we're receiving.
Okay, exactly. Thank you, sir.
Thank you.
Any more questions? As we have more updates on what state funding will look like for next year, we will come back to the board and update you. it's at very uncertain times, and they can seem a little scary, I think, especially when we look at, you know, the 15% reduction in those numbers. But I'm sure TA will have to come up with some plan as to how we're going to treat our attendance and our ADA. But once we know that, we will come back to the board with more information. That's all I have.
Thank you, Ms. Watts and board members. With us today, we have our consultant from Gallagher. Mr. Lou Arias is here to present with us, give us an update where we stand as far as insurance, expenditures, and also the premiums and all that stuff. So, Mr. Arias.
Yes, can you all hear me okay? Madam President, members of the board, superintendent, good afternoon. My name is Lou Arias. I'm with Gallagher Benefit Services, and I was invited today to provide you with an update on your health plan. If you recall, rather than doing it monthly, the decision was made to move forward doing it quarterly. And so we're going to review the numbers for the first quarter of 2020. So I'm going to share my screen. Can you all see my screen?
Yes, sir.
Yes.
Okay. Okay, so we'll go ahead and start with the agenda. I'm going to show you the plan overview that you've seen before, which is the financial monitor report. I will also show a few slides that I pulled from the Blue Cross Blue Essentials to show some, in this particular quarter, I wanted to show some examples of the power of Blue Cross's discount, which is why they were awarded the business to begin with. Then I'll also show you the ESSA dashboard to show where you are with your prescription drug plan, what are the drivers of the plan, and what is the top diagnosis or indicators of that plan. So what I did here is, you've seen this report before, but I also want to point out, because I heard you all loud and clear, is that these numbers are for this year, 2020. Below that, if you can see my cursor down here, I'm showing the same time through the same time period last year so that you can do a comparison. So as you recall, this is the head count here. These are your actual claims for medical and pharmacy. And then we start adding in all your fixed costs, which is your admin fees, the stop loss premiums, and then we put those all together and we bounce that against what the district contributes towards the employees, and we also add in what the employees contribute when they're adding dependents or buy up to a richer plan, and then we bounce that against your actual claims, and we come up with a number. So where I'm going to be looking here is through January, February, and March. So for January, you're coming in at a deficit of $91,500. For February, you came in at a surplus of $55,182. And not surprisingly, and I'll tell you why here in a bit, for March, you're at $397,440. And so for your total plan cost year to date, through the first quarter, starting in October, you're at a positive $26,767. Now, I know that doesn't sound like a lot, but if we look at last year and compare it through March 19, this time last year, you were at a deficit of $224,417. So you are doing much better in comparison to where you were last year. And the reason I said not surprisingly that the claims are a bit higher in March, there's two reasons. Claims tend to peak during the spring, which is March, around spring break. And the summer months are usually also when they tend to peak. And then we also see those in the last quarter, mostly in December, the end of the year. The other reason is because March was the month just prior to the orders to go in shelter in place, and where these services were no longer going to be available. So we saw a lot of ISDs have an influx of prescription refills, early refills, having surgeries that maybe, or procedures that were scheduled for April and May, all done in March in preparation for the shelter in place. Now, having said that, the flip side to that, and we'll see that starting next quarter, is that we anticipate your claims for April, May, June, and possibly even a little bit in July. And then, of course, we'll have to reassess given the situation. But for April, May, and June, we are going to see your claims drop because a lot of the claims that or procedures that were deemed non-essential or elective have either been postponed or canceled altogether. And so your folks are not going to the doctor. They are not having surgical procedures, advanced imaging, and whether they're essential, your non-essential surgical procedures and elective surgeries due to the shelter in place. And so you'll see a dip in claims for those months. When we presented a model for your non-COVID-19 impact and COVID-19 impact. And so we showed that the claims for COVID-19 were minimal, but the overall effect to your health plan was you were actually going to have a negative effect when it comes to the COVID-19 because of the offset of these claims that are not going to happen or be paid in April, May, and June. Now, yes, some of them may be rescheduled, but our models are telling us that a lot of these, 25 to 30% of them, will be canceled altogether and maybe rescheduled at the beginning of the year. But we're showing that 25 to 30% of those will not. So I just wanted to give you a heads up. That is why you see a slight or an increase in March, is because everyone was getting their refills and running to the doctor because they knew that at least for the next couple months, and who knows now going forward, when those procedures are going to be able to be rescheduled. And so again, I just want to take you to the deficit of $224,000 last year through March in comparison to your $26,000 surplus. Now this is all your plans combined. So for all your plans, 44% of that was medical expenses, 29% of that was pharmacy, 7% was your admin fees and premiums, which is 14%. Again, you're running at a 26% or $26,767 surplus on all plans combined. Now, when we go to your medium plan, now we're looking at each plan independently. If you'll notice here, there's almost 2,000 employees, subscribers enrolled on this plan. And so again, we'll look at January. The cost of the plan, the spend that month was $1 million, just a little over $1 million in February, and again in March, 1.2, a little bit of a spike there, again for the same reasons. But if you look at your total year to date, you have a surplus based on your budget, based on what's been budgeted, of $5.6 million. If we look at last year compared to March 2019, the same 3 months, January, February, and March, you were at a plan spend of $7,196 spent. So you are $1.5 million better than you were last year on this particular plan. So once again, you are running better when you did make the change over to Blue Cross, and I can share with you once we get to those network discount slides where this all makes sense in comparison from one carrier to the other. So same breakdown, 44% of it's medical, 29 pharmacy, 9 admin, 18% of it's your stop loss premium. And again, for that plan, the total cost was $5.6 million. Now we go to your high plan. You only have a little over 200, and that's because this is the plan that the employees buy up to. So they pay extra for this plan to have the lower deductible. So for January, the spend was $292,000, February $241,000, and in March $205,000 for a total of $1.2 million year to date. If we look at the same period last year for January, February, and March, the spend was $1.7 million for a difference of $542,000 better than you were last year. So again, looking at last year in comparison to this year, you are doing better to a tune of about $450,000. If we do the breakdown, 51% of the cost on this plan is medical, 37, which is high for pharmacy. So we want to keep an eye on that on the buy-up plan. And it does mirror, if you notice, the medical on the other plans was 44%, 51% on the buy-up. So naturally, if the medical's costing more, not always, but most times the pharmacy follows along with it. 4% of it's the admin cost, 8% of it is for the premiums. And again, your total plan cost to date through March is $1.2 million. So here we break down just so that you can see what are the drivers and cost. Your individual stop loss limit is at 300,000. And so your number one diagnosis is diseases of the nervous system. You have a 507 claimants, 823 services, and the amount paid is $380,195. That accounts for 9.1 of your total spend. And then so on and so forth, symptoms and signs and defined conditions. This one here, this captures a myriad of diagnoses. It's not as specific as neoplasms, which is cancer, respiratory systems. Those are very, very specific. This particular diagnosis, it's not uncommon that it has the number of claimants and the number of services because it's a myriad of a bunch of other services that that aren't as specific as the others. But that is your number two driver for 368,000 or 8.7%. And then of course your neoplasms, which are your cancers, is at 8% of your total medical spend. So of your top 10 diagnoses, your top 10 diagnoses are 63%, almost 64% of your total plan spend. So that's not what we hear is 80% of your cost is typically driven by 20% of your population. And so here we're seeing 63% of your cost is from your top 10 diagnosis or claimants. Here are your large claimants over 150,000. That's half of your individual stop loss level. You do have one through March. It hit at 282,000. I can tell you that that person has gone over the 300,000 because you have seen your first credit or reimbursement from your stop loss carrier, and it is this individual here. So when we move into the next quarter, you will see this person continue to be on here if they are still receiving these services. But the district's responsibility as far as paying these claims on this individual has been met. The stop loss carrier starts, the district will pay, but the stop loss carrier then reimburses anything over the 300,000. This particular person accounts for 4.3% of the total plan spend. We look at the same individual here, and they are on the medium plan, which is your base plan. Sometimes that's good information to know. We put the gender, the age band that this person is in, and then the disease. That's about as much as we can provide without violating any protected health information. But we do provide this just so that you're aware. Normally, we would see more people on this as we start to go into the 7th, 8th, and 9th month. Right now, you're only showing one that's over 150,000. So now we start to move into a little bit of Blue Cross and their utilization and what they actually are billed for and what they actually allow. And that difference is what accounts for their discounts. And so if you recall, when we did the RFP, we used claims from the prior year that UHC paid, and we had all the other vendors running through their system so that we could see who paid the least amount for the same services. And that was a big factor as to why Blue Cross was selected, because they did have the bigger discount based on that claims exercise. And so in this overview, and again, these are numbers through, this should actually say March, my apologies, it says January. But for inpatient, in-network inpatient facility and outpatient facility, and then of course professional services, you're showing that 8.6 million of it was covered. 5.8 million of it was a discount. That means their negotiated rate for all these services in these particular settings, whether outpatient professional. Blue Cross had a significant discount to those, so it's reduced by 5.8 million. Equates to about a 68.2% discount. So of the 8.6 billed or covered, only 1.7 of it was actually paid. And so again, this accounts for why you're looking better this year than you were last year. If we look at the bottom, that's basically for out of network. Typically, this number doesn't get very big because very few people go out of network because the benefit is a reduced benefit. Although you did have somebody for $152 and it was a provider because it's listed under professional services. Same type of utilization report, but here it's showing the claimants based on the dollar amounts. So I won't go through every band, but if we look at the first band, less than $200, you had 976 claimants, 90,000 paid. The claimants paid $93, and if we go to anything between 30 to 50,000, there were 10 claimants that fell into that category. That's about a 0.4% of all your employees, and 403,000 was paid, which is about 13% of your total spend. If we go to the bottom section here, it just starts to increase in dollar amount. You did see that one individual that was at 283,000 that is in fact at 300, and that person shows up here at the 250 or 500,000. And so we just wanted to show you this information as far as where your money is being spent. And again, you only have one person that's in that that's over half of the $300,000 mark. You have one that's at 100 to 150. So again, this explains as to why you are running better, the discount, and then the number of people and where they stand as far as their spend. Here are your highest cost claimants. It just gives the gender and the age band and the diagnostic categories and the dollar amounts for inpatient, outpatient, professional services. These do mirror what we had already said, but I wanted to break them down here. If we move on, now we can go to the pharmacy side. And so this is a dashboard that ESI provides on a monthly basis. This is through March. So if you look at your total drug spend, you're at, and this breaks it down for per employee per month, per member per month, I'm sorry. And it breaks it down for specialty and non-specialty. So all together at $76.63 versus the $84.45. When you go to, and these again, the gray is your peers meaning the other school districts in the collaborative in the state of Texas. So you are doing better than the other school districts in the collaborative. When you go to specialty drugs and non-specialty drugs, you're still doing better by about $1.55 or $1 and change at $50.46. But when we get to specialty, specialty is really what drives your pharmacy. Those are your medications that end up on the commercials of the Super Bowl, the billboards, and on TV. And those are the drugs we really want to keep an eye on. And so your specialty drugs are coming in at about $26.18 per member per month. You are doing better than your counterparts in the collaborative in the state of Texas or book of business. If we look to the right, I think I had mentioned this the last time that we spoke. Diabetes is your number one cost driver on pharmacy by far. And what I always like to say about the diabetic piece is that it's great that people are being treated, but with a number like this or that being number one, what concerns me is that these are the folks that have already been diagnosed. And so how many haven't been diagnosed and aren't going through treatment is really, because they won't show up here. Where they will show up is on a high cost claimant when they go to the ER and they have a major episode. Inflammatory conditions, those are specialty drugs like Humira. Cancer, not surprisingly that it's up there, and then your HIV drugs. And so here's a nice little breakdown. The generic fill rate is something to look at. 83% of your employees are using generic. That's a little bit less than your peers in the collaborative. So we might want to look at when we start going into your budgeting and plan designs, maybe finding a way to incentivize people to use the generic over the other drugs, because that could be improved. Your 90-day supply, you have 33% of your employees utilizing that, which saves the district and the employees money, and that's better than your peers. So overall, if you look at your specialty drug, you are doing better than your peers, but 34.2 is a bit high. We want to see that around 25 to 29. So we need to look at some programs that address your specialty drugs. If we look at your plan performance, the plan cost per member per month is about $108.35. Your member cost contribution, your member cost contributed 0.2 million to the plan, and your rebates, this is important, your rebates reduced your plan cost per member per month by $108.35 to $76.63, or minus 29.3%. If you recall, when we do the pharmacy analysis, we double check or check to see which carriers are providing rebates. Not all carriers do that. What some carriers will do, and United Healthcare was doing this on your previous plan, is instead of giving you the rebate for the drug, they gave you a rebate credit up front. So they were giving you a very low admin fee in exchange for them keeping the rebate. And so what we did is we wanted them to show it as a pass-through. Charge the admin fee what it cost, and the district would get the rebates back. And so with when ESI won the RFP, the rebates equate to approximately $658,434, and that's significant. Rebates are mostly on your brand name drugs, and those come to the district about 90 days after each quarter. You all should have received already, or very shortly will receive, your first quarter rebate check for approximately $157,000. So if we go to just your specialty detailed, because again, I mentioned specialty quite a bit, is your plan cost per member per month is about $6.72 lower than your peers. Again, that rebate helped you guys out. And you do have 20 unique specialty patients. So these are the folks that are going to be using your specialty drugs. Not that we don't want them to take them, right? But we want to make sure that they're using the right drug for the right disease at the appropriate time. We're not here to practice medicine and tell the doctors what to prescribe and what not to prescribe, but it is a school district, taxpayer dollars, and it is probably one of your higher lines on your budget, and so we want to be mindful of the spend. If there is a alternative that is more cost effective, then we want the members to take a look at that and also include the providers. So when we say let's look at the specialty, that's what we mean. We're not saying take them away. We're just saying let's look at programs that will encourage people to use something that's more cost effective but can provide the same effect. And if it doesn't, then they use the specialty drug. Here are your top 10 indications. Again, diabetes represents about 0.4 million, or 24%, almost 25% of your total plan. And so we really need to do some programs for those diabetics. Your generic fill rate, we talked about that earlier. You are behind by about 8.5 points. So we need to look at programs. We're looking at plan designs that encourage employees to take the generic versus the brand name drugs. And here's just a list of, and it actually shows the ranking of where these drugs fall and the number of patients and the dollar amounts. Here's your top 25 drugs being prescribed. These represent about 61% of your total plan cost. 11 of your top 25 are specialty drugs. Okay, so you heard me talking about specialty drugs driving. Of your top 25 drugs, 11 of those are specialty drugs. And one of those is Trulicity, which is a diabetic drug. And you saw where diabetes falls in your, as far as the top indicator for pharmacy. Does anybody have any questions on any of the information I just reviewed?
Yes. Lou, you talked about looking at the specialty, that's maybe something that needs to be looked at.
Correct.
When you're saying it needs to be looked at, who specifically are you referring should be looking at it?
So we've already started to look at it. It would be Gallagher and ESI, which is your PBM. We've been talking to them about several programs. One in particular is called the Smart 90. No, I'm sorry, Save On 90. And what it does is, since ESI has all this information and they know these specialty drugs are out there and being used, they will actively go out and search. A lot of these manufacturers provide coupons for members to use to help offset the cost for the member. So then it's no cost to the member. But what this program also does, if a member uses a coupon today, it only relieves the cost to the member, not the district. And so what ESI has done is they search and they scour with all the manufacturers to match up with your specialty drugs and find those manufacturer coupons. Then they use the coupon to the district's advantage. So if the member's copay is $50, but the manufacturer coupon is worth $1,500, they're only using $50 of that coupon. So what ESI does is they inflate the amount of the copay to $1,500 so that the district gets the benefit of that $1,500 manufacturer coupon. And so we've already started to model this out to provide you what we think that savings would be.
Okay.
So
Okay.
it's stuff like that.
Now, also, let me see. Before, when we had the prior insurance workshop back on March the 5th, we discussed some of the things, and one of them was you were going to run a report to determine the number of employees that had been affected with a $5,000 deductible. Have you been able to provide
I haven't
that?
been, I did pull a report on the Blue Essentials, but what it does is it gives me a percentage of all the employees that have met. It doesn't tell me 10% of the employees have met the deductible, 5 have met half. What it does is it gives me a dollar amount. When you add them all together, in other words, it would say something like $26,000 equates to employee deductibles, but it doesn't break it down as to percentage. So I need to dig a little deeper into that Blue Essentials, and if they don't have it, I need to ask them how they can track it.
Yeah, that should be able, I mean, you should be able to run a report that tells you like 10 employees have met the $5,000 or exceeded the $5,000 deductible.
Yeah, that would have to be probably an ad hoc report that they would have to run. What they provide us today is their Blue Essentials report, which is an aggregate report. I need to ask them to run that, but they do. The one thing, Blue Cross does a good job with all the other stuff, but they do tend to take a while to respond to reports.
Right, and only that one, because we need to know whether this is affecting 20% of our district employees, or is it affecting only 5 district employees versus 500? See, we don't know. So if it's affecting a lot of employees, and that's something that we would need to review and revisit and look at other options. But if it's only a few, like 3 or 4, see, when you don't have that data in front of you, it's very hard to know how it's affecting your community.
Sure. So if we look at, I don't know if you can still see the slide. This isn't what you asked for, but it might give us a little bit of a hint of what that looks like. But I agree with you, because when we start getting into budgeting and then we talk about plan designs, we're going to want to know how many met deductible, how many exceeded the deductible and are now into the out-of-pocket or co-insurance. But if we look at the cost between $1,000 and $5,000, here are the people that would have had to have paid their deductible. 298 people.
Okay.
Between $200 and $1,000, you had 1,000 people that have not. That I could comfortably say that have not met their deductible.
And this is all plans put together, right? This one, this form.
Correct. Correct.
Okay. Oh, okay. So maybe about 300 employees, more or less.
More or less have met their deductible on plan 1 and plan 2, because the base plan has the $5,000 deductible and the base has the $3,000. So at least
because it's from 1,000.
They would fall in this category here. Maybe not all 298, because it starts at 1,000.
Exactly. See, yeah.
But we would need to fine tune that area to find out how many, because all of these folks here are now met their deductible, and now they're on co-insurance, and they're paying their co-insurance piece. But I can see if I can fine tune this area here at about starting at 3,000 to 5,000 and get this number.
Exactly. Then it's not really a catastrophic large number of employees then
Correct.
on that, but it would be good to know a more accurate number. So thank you.
Correct.
Now, the other question that I have also is that you were also going to provide us a list of the urgent care, I guess, costs that had been experienced over.
Yeah, on the reports that on the utilization reports that I ran last quarter, I showed you what your urgent care numbers were, because they were actually they weren't high. It was the ER visits, and we were trying to encourage people to use urgent care over the ER, and the request was made to get a listing of the urgent care centers out so that can be publicized. My apologies, I did not follow through with that piece. I will have it to you by the end of the week.
Okay, thank you. Now, I have a question more for Ms. Cancino, Lou, before you go off. Ms. Cancino, are you still there?
Yes, ma'am.
Ms. Cancino, you as a financial person, I'm sure this is the biggest expenditure besides payroll that we have in our school district. In comparison to previous year, are you seeing a reduction in our expenditures overall?
I am.
Everything together?
Yes, ma'am. I am.
Approximately about how much are you?
I would need to go back and look at it, because what we did is that we were able to move this is two different things, right? This is a plan year, and then we have a fiscal year. So what we were able to do, that some of the things that we were able to move into last year, about $1 million worth of claims. So whether the plan, I think when you want to look at it to see if it's working, I think we need to look at it from this report as opposed to the financial report that we do. So when I look at this, I do see the plan working. And on the financial side, it will show, and I think it will show at a bigger effect than it does here on this report.
Right, exactly. Okay, all right, perfect, excellent. Thank you.
Yes, ma'am.
Any other questions?
Yeah, I do have a question, Lou. This is Pettis.
Yes, sir.
The question I have is, if you look at the aggregate numbers, if I look at them here, looking at what you showed on the red as a positive for us, I see right now progressively in this quarter, or this fiscal quarter, we have a savings of approximately what, $2 million?
About $2 million, yes, sir.
So if this continues with this trend, so we would see probably, and this is best case scenario, if everything was to stay as the way it is, which we know it won't, but if it did, it'd probably be looking about $6 million in savings for the year.
If we look at it that way, yes, sir. You can also look at it in that we funded to the max. So if you come below the maximum claims, that was the whole idea, right? Is to fund to the absolute worst case scenario. And based on what we're seeing here, we're not going to hit that. So there will be a savings. What I want to caution you with is April, May, and June. When we look at this in August, it's going to look artificially low because of those non-COVID medical procedures.
Right.
And then you'll see a spike again, but we don't think it's going to be a big spike of the ones that get rescheduled, and it'll help offset. But I am confident that we're going to come in below what we funded for, and what we funded for was the worst case scenario, and that is why we had to make such drastic changes to the health plan.
Right. Now it'll be interesting, though. Probably better, deeper analysis will be to compare up until February, I'm thinking. And only because I think once the COVID, more people were reluctant to go to the doctor. So those may be outliers that throw your statistical numbers off. So I think a better analysis would be to run it up until February before the COVID-19.
Correct.
Those may be outliers the rest of the months.
So the other thing that I will mention is by the end of next week, our actuaries and underwriters have already started your cost projections. And basically what that is they look at your trends and they see what the trends are out there for school districts using your claims. And we start to prepare for a budget, as you guys are doing today. so that we can tell you what needs to be done to your health plan for the next plan year. And in that calculation, we are including your COVID-19 impact report. And so that will be included in there as well. I should have that by the end of next week. Once we do that, that gives us an idea, right? We look at it and they say, we think here's what's going to happen for the next 6 months and the 6 months after that. And here's what needs to be either infused into the plan, or you will not need to do anything to the plan.
So, Luke, when did you say you'd be able to give us a better number on those 298 on the 5,000, between the $1,000 to $5,000 deductible?
Give me a week. Give me till the end of next week. I'll call Blue Cross, and instead of doing the emails, and tell them exactly on those 298 people that fall between the 1,000 and 5,000 to show me, to see if they can break it down to me. What I'd like to do is do 100% of deductible and how many are at 50% of deductible. I think that'll paint a better picture.
Yes, because I think that'll help us plan better whether we need to make adjustments or if not. I think that's good information. Thank you.
Yes, ma'am.
Well, I think the adjustments should be made regardless. I mean, because if we have a positive, I mean, even if you were to make the change, that would be offset by the positives we have already. So the monies will remain there until we see, you know, the gains, if you will, from the savings that we have across the board over the period of time, given that the COVID-19 does not become a mitigating factor that affects our population.
Correct.
Okay. Thank you.
All right, thank you all. Does anybody have anything else? Okay, I appreciate your time. Good seeing everybody. You guys stay healthy.
All right. Next, we will go into the consent agenda. Is there any clarification and discussion that any of the board members would like to bring forward on these items? If not, I ask for a motion.
Make the motion to approve.
I second.
Motion made by Mr. De Los Rios, second by Colonel Perez.
Favor?
Mr. Guerrero? I can't hear him.
In favor.
Okay. And I also vote in favor. Motion passes. Next, we're ready to adjourn. The time is 1:08. I need a motion to adjourn.
So move.
Motion made by Mr. Guerrero,
Second.
second by Mr. Colonel Perez.
Favor?
Favor.
David?
Favor.
I also vote in favor. Motion passes. Meeting adjourned. Thank you. You all stay safe.
Bye.
Bye, guys.
Blessings, everyone.
Bye.
Good to see you.
So that means